Hi guys, how we doing? I'm Greg from the YouTube channel Growing Older Gratefully. How's everybody tonight? It's about 8:30 p.m. Central Time here in Fort Walton Beach, Florida. So I hope everybody's having a good night. Just wanted to jump on here and continue to share my story about my road to recovery from hip replacement surgery. I had mentioned yesterday that a woman who was rehabbing with me in the facility where I'm at here in Florida, her situation where she was about 7 weeks or so into recovery, and she's struggling with it. So what I discovered too, and I guess for me, maybe I'm taking it as a sign, talked to a friend of mine today from Illinois, and she had knee replacement surgery about a week and a half before I had my hip replaced. So she's about 4 weeks into it, and her theme was the same as the woman that I had met, yesterday at rehab, where she's 4 weeks into it. She's complaining of a lot of swelling, a lot of soreness, and so forth. So I was kind of just kind of seeing, well, where is she at? But I think with that, I think what's going on partly there is she was complaining, and keep in mind, it was similar to what I was saying. She's been sitting too much. She loves her recliner, as she says. She has a teenager, so she was complaining that she's cooking, cleaning. She doesn't have any help, so I can understand that. Two things that I believe are going, like I had explained to her, two things I think, and of course I'm not a professional, but my thing is that I think is going wrong there is she's sitting too long. The sitting in a recliner, watching TV, enjoying some music, that's all fine, but you got to sit, get up, you got to sit, you got to get up, you got to move. And I believe that to be the case, whether in her case it's a knee, my case it's a hip. The second thing is, I think what's going on when she's talking about cooking, cleaning, some of the movements, and I would definitely say the cleaning probably is not a good idea a few weeks post-surgery. And then definitely if you're saying that you're on your feet for too long of a period of time, because my advice to her was, my take on it would be, you got to be able to sit, you got to be able to stand, but then you got to be able to get off your feet and get that leg up so you can keep that blood flowing properly, so you don't have that swelling. And then lastly, what I had told her, once I found out what her situation has been, I knew going into it she was going to choose the home PT at first. She's about to, I think she said the next couple of days she's about to do at the clinic, the outpatient. I'm going to say, guys, having my therapy originally started outpatient, I'm a firm believer in the outpatient, because as I explained to my friend today, you can have somebody come in and explain, hey, here's the 5, 6, 8 movements you need to do, and preferably you need to do this amount of reps and this amount of sets. Let's be honest, guys, unless somebody's really pushing you, you may slack a little bit. I'm just being honest, myself included in that scenario. That's why with me, I explained to her that I joke about my physical therapist, Hannah, but no, she's a go-getter, and like I said, I wouldn't want it any other way. So with that, I think I was explaining to my friend that I think the best thing that's going to happen to you is you're going to have somebody that for that hour, he or she is going to push you. And then the other thing is, I explained to her my theory. You have to respect that process of this recovery. I think some of the things that she's doing, she's just being excessive in it. Like I said, the sitting, the standing, not having the leg elevated, and I think that's what's really going on with her. Now she does, like myself, I've got an appointment Friday with my surgeon. she does as well. Her calling them and the symptoms that she's having post-surgery obviously have not been enough where they say, hey, get your butt down here like ASAP. Pronto, let's take care of it. So I think it's just going to be a matter too, maybe the surgeon and his staff is going to explain some things to her moving forward to kind of coordinate the fact of the how much she should do and shouldn't do. So now, guys, as far as me, now getting back to my recovery, today feeling very good. Slept very well last night. Today, now I will tell you what I chose to do today. My therapist in my physical training yesterday, she worked me very hard for an hour. So today, mainly just what I've chose to do because I've got therapy tomorrow. So I know the way this thing has been going. I'm not, I'm 59 years old. What do they say? You don't have to be beat over the head to know how this is transgressing here. That tomorrow, time 1, time 2 is a little bit harder. Time 3 was a little bit harder than time 2. So I'd imagine tomorrow's going to be no exception. We're going to get after it. She's going to throw some different things at me, which I'm looking forward to. And we're going to go from there. So I'm already anticipating that. So as far as what I did today was some stretching, some walking, not so much of the exercises. Like I said, I mainly kind of worked through a little bit of them. I wasn't so much concerned about reps and sets, but just kind of still doing the motions, just so that's something that's continually going on with my body, my hip, just that I'm used to those movements. Obviously, I've got a lot of respect for my therapist. She recommends them, then that's good enough for me. And I will say that from yesterday when I was done at 9 something and how I felt last night, tremendously different, 24 hours. Like I said, I'm kind of surprised that I don't have a lot of pain, I don't have a lot of soreness, I don't have a lot of stiffness. So I'm very happy with the way things are progressing. And tomorrow, I'm sure we're going to turn it up a notch, and that's fine with me. So I think a week and a half post-op, I can't complain. Friday, like I said, is going to be a very big day for me because it's going to be the surgeon, and then I'm going to get my prognosis of how this surgery went and how things are going up to this point. And then, like I said, it will be what's our plan for the next one as far as the time frame. So, like I said, I'm looking very forward to that. With that, guys, I'm going to keep this video short. Like I said, not much to report tonight. I want everyone to have a great rest of the night. I'm going to try and relax and get some work done, but be mindful of, like I said, the sitting, standing, the moving, just to make sure I'm moving in the right direction. So everyone, like I said, have a great night. Feel free, leave me a comment, whether it's just to like something I'm saying or truly give me a comment. The other thing is, like I said, keep in mind, my wife and I, we do have a Facebook page, Growing Older Gratefully. We'd love to have you on there. So keep that, like I said, keep that in mind. Now, guys, have a great night, and I will talk at you tomorrow. Thank you.